Hi guys, today we will understand about the SIADH. SIADH, syndrome of inappropriate antidiuretic hormone. Okay, so to understand this topic, you should know, at least you should know the basic idea about the diuretic. Okay, so diuretic, just in simple term, diuretic it's help your body to excrete the extra fluid. Okay, just keep in mind. And we all know that not only the fluid of water, every component which is present inside our body should be at optimum level. Okay, it should not get high, it should not get low, it should be at optimum level. So now let's get back to our main topic, that is SIADH, that is syndrome of inappropriate antidiuretic hormone. So what is syndrome and what is the basic difference between the syndrome and disease? In syndrome we don't know the cause. Okay, just keep in mind, in syndrome we don't know the cause, but still your body show some kind of sign and symptom. And in disease we know about the cause due to which your body is showing sign and symptom. Okay, just keep in mind, in syndrome we don't know the cause, and in disease we know the cause. Okay, so now what is the antidiuretic hormone? Antidiuretic hormone, it is the hormone which is secreted by your body. I'm not going to explain you the mechanism, just keep in mind, antidiuretic hormone, it is a hormone which is secreted by your body, which helps your body to retain the fluid. Means it is just opposite of that diuretic. Okay, means what is happening with diuretic it's excrete the fluid, and antidiuretic it's retain the fluids. So in normal condition it's help our body to retain the extra fluid. Okay, so when our body get dehydrated, so your body homeostasis start to work, so it secrete that antidiuretic hormone, it's retain the extra fluid. Okay, it is the homeostasis, okay, I can say. But in this condition, that is SIADH, that is syndrome of inappropriate antidiuretic hormone, your body secretes extra antidiuretic hormone. Means if your body secreting an extra antidiuretic hormone, means your body will retain extra body fluid. Okay, it will be harmful for our body if our body will have that high concentration of fluid than normal. Okay, as I said, everything inside our body should be at optimum, not get high, not get low. Okay, so antidiuretic hormone, just keep an antidiuretic hormone, it is helpful for our body. Okay, it is helpful for our body to maintain the fluid concentration inside our body. Like as I said, in dehydration, if our body is in dehydrated mode, then your body will secrete ADH, so it will retain some fluid inside your body. Okay, so in this condition, as I said, it secretes extra antidiuretic hormone, so extra fluid retention will occur. So what is happening, what is the mechanism, and what are the effects it show? So let's understand it. So just to understand it, first just understand the basic concept of between the blood vessel and the tissue, what is happening in normal condition. Okay, so in normal condition, as I said in my previous videos, your blood is made up of various components like various minerals, various proteins, various cells, that is RBC, WBC, platelets, various factors. Okay, right now just keep in mind that the sodium is that element, is the one of the element of your blood. Okay, it is present in your blood and it is present in your tissue also. Okay, just keep in mind that sodium. Okay, it is going to easier for you to understand the SIADH. Okay, consider this is blood vessel and this is tissue. So the basic function of tissue, the tissue, it takes the essential component from the blood like oxygen and number of components. Okay, and makes energy. Okay, and right now I said just keep in mind that sodium. So when your body, it is a normal condition. Okay, means if just keep in mind, in normal condition what is happening, the sodium concentration inside the blood and inside the tissue is same, means the concentration between this between the blood and the tissue is same, so there will be no flow of water from blood vessel to the tissue. There are various factors which affects the flow of the water or fluid from blood vessel, that is the hydrostatic pressure inside your blood vessel. I'll not explain you all that hydrostatic, osmotic, oncotic. Just keep in mind, in normal condition there will be no any huge flow of water flow. Okay, but in this condition, that is a syndrome, that is syndrome of inappropriate antidiuretic hormone, your body is secreting extra antidiuretic hormone, means your body is retaining extra fluid which is accumulating inside your blood. Means extra fluid inside your blood, it is causing to decrease the concentration of that sodium. Means your sodium is not going anywhere just because of that extra water, extra fluid. It's affecting that it's affecting the concentration of sodium which is present inside the blood. Okay, means if there will be high fluid or water, then ultimately it will decrease the concentration of sodium. So now what is happening in this condition? Okay, just understand it. Okay guys, so in the SIADH, this is blood vessel, this is tissue. Okay, now in SIADH, high fluid inside the fluid or extra fluid inside the blood vessel means low concentration of sodium inside the blood. So water is going to flow from low concentration of sodium to high concentration of sodium. As I said, there is a means the sodium is not going anywhere. It is present in the blood, but due to that extra fluid, it is affecting the concentration. It is affecting the overall concentration of that sodium. Obviously, that extra fluid affects various components, various elements. But right now, just keep in mind that sodium. Okay, due to that extra accumulation of fluid, it's decrease the concentration of sodium. Okay, due to which that water will flow toward this sodium, will flow toward the tissue. Okay, means what is happening due to the high fluid inside the blood, it decreases the sodium concentration inside the blood, and due to which water flow from blood vessel to the tissue, and tissue now will get swell. Means the size of the tissue will get increased, and it is happening in your whole body. It is happening in your brain also, which is harmful. So now understand what is happening. When it's happened, what your body show, what are the sign and symptoms. Your blood pressure get increased. As I said, your body, your blood vessel is retaining extra fluid. It's increasing your blood volume. As I said in my previous lecture, increasing the blood volume is increasing the high blood pressure. Means it is the effect of that high fluid retention in your blood. Okay, means high retention of fluid in blood means giving you high blood pressure. What is the next effect it will give? That is headache. As I said, that this effect is happening in your each and every cell of your body. Means it is happening in your brain also. Means the inside of your brain, your cell, your tissue will get swell. Okay, means it will increase that intracranial pressure. Ultimately, it will give you the headache. Okay, means it will affect means as you all know that brain is the main part. It is the essential part of our body. Okay, it's affect our body movements. It's affect the sensory motor events. Okay, means if anything which affects in the brain, it will show this some hazardous effect in our body. So what I said, just in SIADH, your tissue, okay, your tissue is retaining the extra fluid, and due to retention of fluid, your tissue gets swell. It is happening in your brain also. Means in every cells of your brain, they are increasing in their size. Okay, means it is increasing the intracranial pressure. It can give you the headache. It can give you this seizure. Okay, means it will compress the each cell, but the neurons. Means it can give you the seizure. Means it can give you the various pathological forms which is related to your brain. Okay, the one of the effect is headache, seizure, and the action potential. Means it can affect your movement of your body. Okay, so these are the some effects due to the SIADH, this syndrome. Okay, so now let's recap it again. What is happening? Your blood vessel retaining extra fluid, due to which it's decreasing the concentration of sodium inside the blood, and due to which your body fluid, the fluid inside the blood, it is flowing from that blood vessel to the tissue, due to which your tissue gets swell, and it is happening inside your body. It is happening each and every cell of your body. Means it will give you the headache. It will increase the intracranial pressure. It can give you the seizure. Okay, or I can say it can give you the infarction. Okay, it is giving I can't tell you the mechanism because due to which the video will get longer. The the length of video will get increased. Okay, so just keep in mind, if your cell of your body gets swelled due to the extra accumulation of fluid, it will give you the hazardous dangerous effect. Okay, it will give you the headache, it will give you the seizure, it will increase the intracranial pressure, it will affect your eye also, it will affect your blood pressure also. So what are the treatment? Okay, what are the treatment doctors perform to get rid of it? Okay, so the first treatment is that they stop the fluid intake. Okay, means the patient with this SIADH, the patient should stop the fluid intake. Means means already they are having the extra fluid inside the body. If they will take the fluid, okay, if they will take the fluid from outside, then it will then it will go to your blood vessel, it will increase the blood volume, then from that blood vessel it will go to the tissue, it gets swell and it will give you headaches, seizure and all. Okay, so first treatment is to stop the fluid intake, then to salt, or to tell that patient to eat salt. Means what happening, as I said, your blood vessel having the extra fluid, due to which your body's your sodium concentration inside the blood is low. So if we'll tell the patient that eat the extra salt, so it is going into your blood, so it will increase the concentration. So when it will increase the concentration of sodium inside the blood, then the water from tissue will flow toward the blood vessel. Okay, this is the second treatment. And in the hospital we can give the 3% saline. Okay, I mean, this is saline where the concentration of the sodium is high. It is same, that's we are eating the salt, so they are another treatment which can give to the patient, that is 3% saline. It will increase the sodium concentration inside the blood, and ultimately water will flow toward the blood vessel from the tissue, and it will decrease the effects of this syndrome, this SIADH. Okay, just recap it. Okay, what is happening here? What is the whole concept of SIADH? That is syndrome of inappropriate antidiuretic hormone. Here your body is secreting ADH, extra antidiuretic hormone, due to which your body is retaining extra fluid, due to which the sodium concentration inside the blood vessel is decreasing, and due to which your body is flowing from the blood vessel to the tissue, and tissue gets swell, and it is happening each and every cell of your body. It is happening in your brain, and it can give the headache like symptom, it can give you the seizure, it can increase the intracranial pressure, and it will be the more hazardous, it will be the more dangerous for your body. Okay, so what are the treatments? And the treatment will be, like as I said, first stop the fluid intake, then second start the salt intake, and 3% saline, means it will increase the it will increase the sodium concentration inside the blood. So it will increase the sodium concentration inside the blood, so water or fluid now flow from that tissue to the blood, and that blood will go to the kidney, and kidney will excrete that extra fluid. So this is the whole concept of SIADH. Okay, I think now you all know what is happening with the SIADH patient. Okay, what is the mechanism? This is the basic understanding you should know. This is the basic concept you should know about the SIADH. Okay, so this was all about the SIADH. I hope you will like it. Thank you.